Hypertension is a persistent condition identified by a constant rise in high blood pressure numbers above the limits over which cardiovascular danger increases. According to numerous international studies, cardiovascular morbidity and death are directly associated with the rise in sustained systolic stress degrees over 139 mm of mercury or sustained diastolic stress above 89 Hg, both for disease difficulties. Coronary is for cerebral vascular mishaps, heart failure, outer vascular illness as well as kidney failure. Regarding 1/3 of the adult population is created and also establishing countries struggles with hypertension, it is the primary reason for an appointment with medical care medical services. On numbers of 115/75 of blood pressure for each increase of 20 mm of mercury of systolic stress or 10 mm of mercury of diastolic pressure, the danger of a cardiovascular occasion is increased. Hypertension is an asymptomatic illness as well as easy to find, however, it includes serious as well as lethal problems if it is not treated in time. Persistent hypertension is one of the most vital flexible threat aspects for developing cardiovascular diseases, along with cerebrovascular and kidney illness. It is additionally recognized that males are much more inclined to establish hypertension than women, a scenario that transforms when the lady reaches menopause, considering that before this she has safety hormonal agents that disappear in this duration and from that minute the frequency is adjusted. Therefore, women should be much more kept an eye on for this disease in the years after menopause. Arterial high blood pressure calmly produces adjustments in blood circulation, at the macro as well as microvascular degree, triggered subsequently by a disorder of the inner layer of blood vessels and also improvement of the wall surface of resistance arterioles, which are in charge of preserving the outer vascular tone. Many of these modifications precede the surge in high blood pressure with time as well as produce specific natural source. In 90% of cases, the source of arterial high blood pressure is unknown, which is why it is called essential high blood pressure, with a solid hereditary influence. Between 5 and also 10% of situations, there is a reason directly responsible for the altitude of stress numbers. This type of hypertension is called second arterial hypertension. That not just can in some cases be dealt with and also disappear forever without needing long-term therapy, however can likewise be the alert to find a lot more severe diseases, of which arterial hypertension is just a professional indication. Diuretics as well as beta blockers decrease the occurrence of arterial hypertension negative occasions related to the cerebrovascular condition. Nevertheless, diuretics are extra reliable in lowering occasions pertaining to coronary heart disease. Hypertensive individuals that fulfill their therapy are less likely to develop serious high blood pressure or heart disease. In most cases, reduced doses of diuretics are utilized in the senior as preliminary antihypertensive treatment. In elderly clients with separated systolic hypertension, a long-acting calcium channel prevention, dihydropyridine type, is typically utilized as an alternative therapy. In elderly people with straightforward high blood pressure, trials are still underway to assess the lasting results of angiotensin-converting enzyme inhibitors and angiotensin II receptor blockers.